It's day 2, September 5th, 2017. The doctors' indefinite strike continues. The absence of doctors is beginning to bite. Nigerians want a quick intervention by the federal government and the doctors. Perhaps some federal government-owned hospitals which rendered services to patients have only yielded to the directive by the health minister, Professor Isaac Adewale, handed down to medical directors and chief medical directors to provide health services at the hospitals amidst the strike. It's time for another dialogue between the striking doctors and the federal government after the previous ones failed.
When the firing is too much.
Before proceedings, resident doctors jointly walk out to build consensus opinion. The ministers of health and labor arrived with a clear message to the striking doctors.
In most cases, or in some cases, they were not. Any other strike can be handled in a way that you don't even care so much about the little time you lose. But in essential services, especially medical services, we can't replace lives that are lost. By Section 18 of the Trade Dispute Act of the Federation, T8, T9, 2004, once a conciliation starts by the minister, no party is allowed to do a lock of employees, that's the workers, or embark on strike against the employer.
We hope the trust that wasn't there when MOUs were signed will be restored at this meeting. And once that trust is restored, and evidences of the implementation of those 6-point demands are seen, I hope we'll reach. This will be the very shortest strike. Excuse this meeting.
It's a long hour of discussion that ends in a deadlock. Another meeting is convened for the next day. This lasts throughout the night of 6th to the early morning of 7th of September. Finally, the parties arrive at a resolution. The striking resident doctors will consider suspending their industrial action if the federal government pays the shortfalls of their salaries and allowances.
This meeting agreed that the NAD national officers are to present the outcome of this renegotiated memorandum of terms of settlement to an emergency meeting of its members by Friday, September 8, 2017, with a view to suspending the strike once there is evidence of payment of the mandate earlier presented to this meeting to the affected institutions. Finally, we also agreed, as item number 9, that no member of NAD will be victimized as a result of his participation in this strike. We expect that payments should be made to the affected federal tertiary health institution on or before Friday, September 8, 2017. We also agreed that the second batch, which is List B, mandate will be treated as soon as their AIE is sent to Office of the Accountant General of the Federation, since NAD claimed that PICA had already verified those shortfalls.
In all of these, the private hospitals are witnessing influx of patients who may have to pay through their noses to be treated. Dr. Tokumbo Olajumoke, a medical consultant, says he believes government is responsible for the decay in the health sector. He says formulating the right policies alongside inclusion of the doctors in the policy formulation, coupled with the provision of funds, can restore the health sector.
So funny, I know every pressman will come to this statement that there is a physician oath. But I always tell people, this has been in practice for ages. And when they're even making these oaths, they presumed some conditions to be constant. They presume that under no condition will doctors be suffering. Nobody assumes we get to this point that doctors will not be paid for several months. And that's why when you say physician oath, I would say it's applicable to those days when they were making the oath. Nobody actually thought the healthcare system would decay to the extent of doctors not being paid 4-6 months salaries, doctors being owed several years of salaries and arrears. So when you are looking about the physician oath, it's making so many assumptions. Consider everything is all right, doctors are well paid. That is when you can quickly apply that physician oath. But in a place where doctors are not well remunerated, there's no you can start talking about physician oath. Doctors cannot be collapsing and be dying on duty, and you are still saying that you are sworn to an oath. Whatever oath you are sworn, you have to take care of yourself first before you start taking care of others. If doctors are not well taken care of, they won't be in the best frame of mind to even think of offering their best for the masses. If doctors are not well paid, they can't actually meet their financial obligations. Even when they see patients, it's even detrimental to the health of the patient. So unless we actually take this one as being paramount, once we have that will to make sure that healthcare system is given priority, then every other thing will fall in place. That's the truth. So it depends on the government taking health as a priority. Once they do that, every other thing will fall in place. They will provide everything for doctors to work, and they will pay doctors as at when due and give them what is their due. Once those ones are ensured, I can assure you we have a robust healthcare practice devoid of strike.
Dr. Olajumoke wants the federal government to invest in medical research centers to avoid unpreparedness in the case of epidemic.
Ask me now, talking about laboratories, how many do we have in the country? Maybe 2 or 3 all over the country. You have a viral outbreak in Oshogbo, you have to go all the way to Lagos before you can make diagnosis. And these are things that are supposed to be present all over the country. So that's why I'm saying it's not about the healthcare givers. Even if we are working 24/7 and there's no definite response plan by government in terms of epidemics, it will still fail. And we still put the healthcare givers at jeopardy because there is no even protection for healthcare givers. Most of the teaching hospitals are meant for both service, teaching, and researches. But I can assure you, most of the hospitals are failing in those 3 respects. You teach today for 2 days, 3 months, the next thing there's a strike. There's a break in teaching. And when there's no teaching, there's no research. Everything goes together. It's only when you are teaching that you can say you are researching. Teaching, service, and researches, they go together. Once you are not delivering service, you can't teach, and you can't do research. Policies and funding goes together. If you have policy and there's no financial strength to actually execute those policies, it amounts to just paperwork. So there are policies, but even those policies were not carefully formulated. I kept on saying, when you are making policies and you are not actually factoring the executors in making those policies, it's bound to fail. You can't just wake up and say you want to make health policy without involving doctors that are going to execute those policies. So when you are forming policies and you are not involving the executors, it's bound to fail. And even after you have involved them and you are not providing the finances to execute those policies, they are bound to fail.
Dr. Sekinat Bola Oyebamiji shares his views.
I think we need to go more in the way of health insurance. We need to fortify our NHIS system. The policy needs to be evaluated. More of Nigerian populace need to buy into it because insurance involves spreading costs. And if you have, the more people you have to spread, then the more resource they have, and then the more benefits that the enrollees can derive from this. Because if we have a good health insurance system, it shouldn't matter whether you have money or not. Care or the quality or extent of care you get should be based on your need. It should not be based on what you have in your pockets. So, but the way the policy is presently, there are lots of treatments that cannot, even investigations that will not be that cannot be offset by the NHIS presently. So that's one point. I believe when more people buy into it, and then we get the private sector involved too, it should get better. And then the policymakers or the government and their agents need to beam a searchlight into how the NHIS is being run. The resources they have, what are they doing with it? Do we need to inject more funds? Are they utilizing what they are getting presently well? These are all issues.
According to experts, in the 2017 budget, Nigeria will spend 1,688 naira on the health of each citizen in the year, from a meager of 4.17% of the national budget of 7.298 trillion naira allocated to the health sector. Currently, the health sector has 304 billion naira to cater for over 180 million Nigerians.